Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Anna Botari. Today's topic is symptoms and concerns of vaping. Why is vaping harmful?
When it comes down to figuring out why is vaping harmful, we have to think a little bit about what vaping is. So vaping is kind of a general term that we use, but it includes a lot of other types of inhaled aerosolized products. So there's dabbing, there's dank vapes, then there's vaping. And so within those categories, there's also subcategories. So there's nicotine or THC, which is the marijuana derivative. And then we have to go to like the sources. So with regards to getting products, there's a wide area of places you can get them. There's home brews, then you can get stuff online, then there's manufactured products. So already we can tell that there's a lot of different substances, a lot of different ways to use those substances. And then once we look into the compounds, there are some commonalities between them. Obviously, they'll have nicotine if it's a nicotine product. Sometimes, depending on the mix, you can have some carbonyls, or you can have some smaller metal particles, or you can have like toxic organic compounds. Sometimes they've even found like components of like a bacteria or fungi inside. So any one of these things inhaled. And then most recently, the CDC just published about the vitamin E, which is a compound that's really not meant to go into the lungs. It's used for other things where if you apply it topically or use it in other ways, it might not be harmful. But obviously, there's been this string, which is definitely promising data. So now, that's I think why it's so hard to quantify exactly which thing it is, and why also the subpart is that when you look at the lung damage that's caused, there's a wide variety of different pathologies. There's about 6 or 7 different things that they've identified, from just scarring to like chemical burns to like acute eosinophilic pneumonias and other interstitial lung diseases.
What are the different ways of vaping?
There's the nicotine e-cigarettes. Then there's something called dank vapes. So that's essentially like a marijuana vape that you can buy that's manufactured. And then there's something called dabbing, which is like a butane hash oil. And that's typically, the contraption is a little bit different. That's more of like a water pipe or like a bong or something that's similar to a crack pipe. And then people will essentially make these highly concentrated types of nicotine things and mix them around with different types of oils, and then they'll smoke them. And then the THC content is a lot higher than you would otherwise expect. So those are like the general ways. Okay. And then within them, there's that huge variety of like, it could be someone's cousin that makes it. Like we had a case here, and that's exactly what it was. It was someone's like, cousin that had made it. Or it could be just, somebody going online and trying it out. Or it could be someone going to a store and getting a manufactured product.
How do you know if you have a problem?
You would assume that a lot of the symptoms are respiratory. And those are the ones that we always pay attention to. But there was a paper that came out from Wisconsin that was recently published that indicated that a lot of people actually have GI symptoms too. So about 80% of them had symptoms of like nausea, vomiting, diarrhea. But then obviously there's the cough, shortness of breath, maybe a chest pain, night sweats. So I think the easiest way would be anyone that has or is vaping or using any of those other products that we talked about, like the dabbing and the dank vapes, and they're worried and they do have a symptom that they're unsure about. The safest thing for them to do is just contact their provider and say, look, I've been using X, Y, or Z product. I'm having these symptoms. I'm not sure if they're related. What do you think? With a lot of the symptoms being respiratory, this time of year, there's a high prevalence of like influenza, other types of viruses. So I think that's why it's important when you're looking at it from a clinician standpoint that you keep that in your differential and you think about that when you're looking at other alternative causes.
What symptoms are most concerning to physicians?
When someone comes in and they have symptoms that we think might be related to vaping, I think one of the basic things that we could do is to check their oxygen levels. And that's really simple, that's really non-invasive. If they have symptoms of a cough or shortness of breath, just check the oxygen level and make sure it's okay. And then if it's not okay, obviously that's going to trigger a whole set of other things. And then another test that we could consider is just getting some imaging of the chest, maybe a chest x-ray, And I think that comes, it's important because with regards to diagnosing a E-valley or a vaping-associated lung injury, one of the requirements is to have bilateral infiltrate. So some kind of haziness on some imaging that's on both sides. And then it kind of goes back to your point where, well, what do we know, what's it from? And so that would be to rule out other alternative causes.
Can vaping cause permanent lung damage?
So can it cause permanent? I'm not sure, and that's definitely something that we're following with our cases and our patients that are coming in and getting better. But it's definitely done a lot of harmful things and sometimes fatal things as well.
Can vaping cause cancer?
With regards to causing cancer, we're still not sure yet. I think at this point we're still in the gathering data phase, and this is definitely something that we'll need to continue to follow over a longer period of time to assess if there is an increased risk of cancer or potentially other things, just like the permanent damage that you're talking about that might predispose individuals to other types of morbidities. What we're trying to do here is just bring more awareness, and I think that if anyone is concerned, I've actually started to see a couple more people in my clinic coming in and they're worried about vaping. So I think that those are all the right questions to ask. And our goal here is to figure it out with you or the patient, and hopefully whatever it is, whether it's minimal symptoms and trying to stop smoking or it's something more serious, our goal is to be here to help out every step of the way.